Welcome back to my classes again. Today I will discuss about epidemiology. So what is epidemiology? Epidemiology is a study of people to gain the people's health related problem. If it is syllable wise divide, then the epi means among, epi means among, demos means the people, and the logos means the study. So the epidemiology means the distribution and determinants of the health related states or events in specified population and the application of this study to the control of the health of this problem. So, what is the simplified form of epidemiology? Epidemiology means the study and determinants of some disease, like nowadays corona. So, firstly, we will study what is corona and how it is distributed among the people, health-related states. So, what about its severity of the disease, and then the specified population in a specified population, like in India its severity different from the population of America. So here then the application, from this knowledge we will apply the uh, vaccine or other related things to the people to control the health related problem which is arise due to this disease. Here is the some definition of epidemiology. So, lastly, a scientific discipline that involves the study of the frequency and distribution of health and disease in order to find risk factors in population for prevention control. Previously, just I said that the firstly we will study and determine the health related problem which issue is problematic in our life or in population health, then the risk factors, the determinants, and then the prevention will be applicable. So, in this slide, I will simplify it. The stepwise epidemiology. Firstly, how the health-related outcome distributed, that is the descriptive epidemiology, and what hypothesis might explain why some people have the outcome and others do not. Means that genetically, if the disease is genetically related or not. The hypothesis of generation. Is there an association between the exposure and the outcome? So analytical epidemiology, in the sense where it is the outcome which is exposed to the people is responsible for this disease or not. Is the association between the exposure and the outcome a casual one? That is casual judgment. Like in this case corona, when the virus is attack the individual is affected from this disease. How we prevent? By using mask or sanitizer. What should be done to prevent control the outcome? Here the individual and social decision making, like using mask or sanitizer. Then after using mask or sanitizer, did the disease is controllable or prevent? So here the did the prevention control strategy work? Evolution of the strategy. And so here is the epidemiology and clinical medicine combined with clinical epidemiology. In epidemiology study with the population, not in individual, and clinical medicine study with the individual, not the population. So in two joint hand uh, made up the clinical epidemiology. Here, the quality of frequency and distribution of clinical events is determined. Then the study the etiology and evolution of the disease to validate the purpose and the ratio use of the laboratory and therapeutic studies. Then the identify the protective risk and the prognostic factors to evaluate and intervene the measurement to support sustained decision and others like that. So here is some important term of epidemiology. The discipline study, which is frequency. Frequency means that the characteristics in a population of people or animal. Distribution means the patterns of disease in a population. The patterns of disease in a population in a particular place during a period of time. Like previous year, corona is appeared. Then the second wave is come. So the when the period, which period it hit again, that is the distribution. And health, what is the health health is affected or it is protected by the diet or other thing. The disease refers generally to an imbalance in the health status of individual or population that result in decrease the productivity of illness or death. Population refers to the group of individual or animals, people that are considered or affected. So, what is the main concern of the epidemiology? Epidemiology mainly concern about community health, not an individual health. So, study of the disease frequency first concern. Frequency of disease means disability or death ratio and summarizing in the form of rates and ratio. A study of the distribution means pattern of disease, that is time, place or person. Study of the determinant means underlying causal or risk factors. So here is the three term which is concerned in epidemiology. Firstly, study of the disease frequency, then the study of the distribution, then study of the determinants. In this flowchart, the the concern of epidemiology is described. So the main objective of epidemiology is to describe the distribution and magnitude of health and disease problem, to identify the etiological factors and the risk factors in pathogenesis of disease, to provide data essential to planning, implementation, and evaluation of service for prevention and control and treatment of disease, setting of services. So here is the difference between clinical medicine and epidemiology. Firstly, previously I told that here is the unit of study in case or cases. Here is study of the population. So epidemiology always study of the population, not an individual. The concern with the disease in person, concern with disease pattern in population, both sick and healthy person. Epidemiologist is interested in the source of infection, mode of spread, and trend of diseases. Evaluates the outcome and preventive and therapeutic measure and give clue the administration effective management. So, thank you.